Swine Flu. Part 1. The article read by Meena Menon. What is swine flu? How is swine flu treated? Swine flu, that is swine influenza, is a disease of pigs. It is a highly contagious respiratory disease caused by one of many influenza A viruses. Approximately 1% to 4% of pigs that get swine flu die from it. It is spread among pigs by direct and indirect contact, aerosols, and from pigs that are infected but do not have symptoms. In many parts of the world, pigs are vaccinated against swine flu. Most commonly, swine flu is of the H1N1 influenza subtype. However, they can sometimes come from the other types such as H1N2, H3N1 and H3N2. The current outbreak of swine flu that has infected humans is of the H1N1 type. This type is not as dangerous as some others. Avian influenza, that is bird flu, can also infect pigs. Avian flu and human seasonal flu viruses can infect pigs as well as swine influenza. The H3N2 influenza virus subtype, a virulent one, is thought to have come from pigs. It went on to infect humans. It is possible for pigs to be infected with more than one flu virus subtype simultaneously. When this happens, the genes of the viruses have the opportunity to mingle. When different flu subtypes mix, they can create a new virus which contains the genes from several sources, a reassortant virus. Although swine influenza tends to just infect pigs, they can, and sometimes do, jump the species barrier and infect humans. What is the risk for human health? Outbreaks of human infection from a virus which came from pigs, that is swine influenza, do happen and are sometimes reported. Symptoms will generally be similar to seasonal human influenzas. This can range from mild or no symptoms at all to severe and possibly fatal pneumonia. As swine flu symptoms are similar to typical human seasonal flu symptoms and other upper respiratory tract infections, detection of swine flu in humans often does not happen, and when it does, it is usually purely by chance through seasonal influenza surveillance. If symptoms are mild, it is extremely unlikely that any connection to swine influenza is found, even if it is there. In other words, unless the doctors and experts are specifically looking for swine flu, it is rarely detected. Because of this, we really do not know what the true human infection rate is. Because of this, we really do not know what the true human infection rate is. Examples of known swine flu infecting humans. Since the World Health Organization (WHO's) implementation of IHR 2005 in 2007, they have been notified of swine influenza cases from the USA and Spain. In March-April 2009, human cases of influenza A swine fever, that is H1N1, were first reported in California and Texas. Later, other states also reported cases. A significant number of human cases during the same period have also been reported in Mexico, starting just in Mexico City, but now throughout various parts of the country. More cases are being reported in Canada, Europe and New Zealand, mainly from people who have been in Mexico. How does a human catch swine influenza? From contact with infected pigs, which is the most common way, from contact with infected humans, which is the less common way. In cases when humans have infected other humans, close contact was necessary with the infected person, and they nearly always occurred in closed groups of people. Can I eat pork meat and pork products? If the pork meat and pork food products have been handled properly, transmission of swine influenza to humans is not possible. Cooking pork meats to a temperature of 70 degrees centigrade that is 160 degrees Fahrenheit, kills the virus? So the answer is yes. Pork meat and pork food products are safe to eat. Where have pigs been infected? As swine influenza infection among pigs is not an internationally notifiable disease, we cannot be completely sure. Swine influenza infection among pigs is known to be endemic in the USA. Outbreaks have also occurred in other parts of North America, South America, Europe, Africa, China, Japan, and other parts of Asia. Is there a pandemic risk? People who are not in close contact with pigs generally have no immunity to the swine influenza viruses. They are less likely to be able to prevent a virus infection. If the virus infects enough people in a given area, the risk of an influenza pandemic is significantly greater. Experts say it is very hard to predict what impact a flu pandemic caused by a swine influenza virus would have on the global human population.
Part 2, Swine Flu, read by Sanjeev Paul. Will current human flu vaccines help protect people from swine influenza infection? We really don't know. Influenza viruses are adapting and challenging all the time. If a vaccine was made, it would have to be specifically for a current strain that is circulating for it to be effective. The WHO says it needs access to as many viruses as possible so that it can isolate and most appropriate candidate vaccine. What are the signs and symptoms of swine influenza in humans? They are similar to those of regular flu and include body aches, chills, cough, diarrhea, which is less common, headache, sore throat, temperature, tiredness or fatigue, vomiting, which is less common. What medications are there? There are some drugs around that can effectively treat swine flu infections in humans and many types of flu infections in humans. There are two main types, amantadine and rimetadine, inhibitors of influenza neuraminidase. Most previous swine influenza human cases recovered completely without the need for medical attention. What can I do to protect myself? Wash your hands regularly with soap. Try to stay healthy. Get plenty of sleep. Do plenty of exercise. Try to manage your stress. Drink plenty of liquids. Eat a well-balanced diet. Refrain from touching surfaces which may have the virus. Do not get too close to people who are sick. Stay away from crowded areas if there is a swine flu outbreak in your area.